Great. So if you guys could all just add into the chat one thing that you're looking forward to most that you haven't been able to do since the start of the pandemic. So we'll just take a quick minute so you can all type that into the chat. I'm seeing travel, swimming at our city pool, going to the movies, live music, travel to Europe, hugging my brother, traveling to a warm place, going to a concert. Yeah, I know. I personally am really looking forward to doing some traveling.
Yeah, probably whenever your mom's ready. 1:30. Yeah, usual time.
And I'm just going to, quick little reminder, if you could just all make sure that you are muted. All right. So I am going to pass it off to Natasha to go over our agenda.
And again, good morning, everyone. So for our time together this morning, we again just want to welcome you. That was our inclusion activity. Thanks so much for letting us see a little bit about what you're excited about to have an opportunity to do. And we are excited that you are here this morning, and we're excited to share with you what our work has been. So that will be what we spend our time doing. So first, we will each go over a summary of what we've been doing for close to the past 9 months. And then we have some individuals who are expert in the work that we've been doing. We'll have a panel discussion with Sarah Shaw from ISB, Andrea Coleman from LAUSD, and also Sarah Cohen. Can you pronounce her last name?
Chevalier.
Chevalier. Wanted to make sure I did not butcher that. And we will listen to their insight about the work that is currently happening in the education space. And then we will have an opportunity for you to ask any questions of us. And so at any point during this conversation, if you have a question, please feel free to drop it in the chat and we will answer it at the end.
So we thought we'd just start with a quick framing of what the Policy Fellowship is. What is it that we are doing here? So the Leadership for Educational Equity Public Policy Fellowship provides fellows with a year-long opportunity, a little shorter, to lead and be immersed in full-time high-impact work with senior leaders in education policy. So there are fellows placed all over the country in all kinds of kind of government positions, with family foundations, at school districts, obviously at state level educational institutions. So really in a wide range of policy positions. And what we all have in common is having taught previously in a high needs environment. So why did the three of us decide to present together today? We were chatting and kind of getting to know a little bit more about the work that each other was doing this year. And we thought there was a really interesting kind of overlap in our work in education finance and budgeting, district and state level strategic planning, as well as student health. And particularly that we did our fellowships in a year where things have been a little bit abnormal in the whole world, but of course in education, and figuring out what all of these three things look and feel like during and after the COVID-19 pandemic. So I am going to kick it off with Natasha, who's going to share a bit, an overview of what she's been up to this year at ISB.
Thanks, Sarah. The mute button, that is what we do in this virtual environment. So as Sarah shared, I worked with the Illinois State Board of Education in the Finance Center, specifically working in the area of fiscal and academic solvency. And so that's a very nice way of saying my work for close to the last 9 months has been looking at how does the state support districts in exploring the connection between their finances and student academic achievement. And so one of the main things that I worked on or have been working on and continue to work on at ISB is looking at strategic resource allocation. So ISB, the Illinois State Board of Education, created the strategic plan, which is the roadmap for the work of ISB through 2023. And it drives equity as a key component of all of ISB's work, making sure that all students within the state of Illinois are going to achieve equitable outcomes. And specifically in regard to strategic resource allocation, the area of the strategic plan that I've been focusing on, this area seeks to support districts and internal agency staff in deepening an understanding of how resources can be engaged strategically to promote equity, both in the distribution of those resources, as well as in outcomes for students. And on the next slide, you'll see a key piece of what this is. And this time has been extremely exciting to work in education finance, particularly because of the opportunities created by the federal funding supports that were provided through the emergency relief bills for COVID. So Illinois alone received over $512 million in funding to support students' safe return to the classroom and to support districts in addressing learning loss incurred due to the pandemic as students were at home learning. And so strategic resource allocation is particularly important in education at this time because these unprecedented gains in educational funding have the potential to lead to unprecedented gains in educational equity. But we must be strategic in how we employ these funds. And part of my work has been partnering with both ISB staff and external partners to support districts in making those strategic decisions. And so through that, on the next slide, another part of this work that I've been doing in supporting districts in thinking through how do we strategically engage our resources to support our students has been engaging with the evidence-based funding spending plan. This spending plan is the result of a push within the state of Illinois for greater equity and how the state distributes state dollars to districts. And the result of that was in 2017, a new funding formula was developed called the EBF funding formula, which I will explain in a second. My work though with the funding formula has been the EBF spending plan, which is a plan the state asks districts to use to strategically plan how they will use the funds they receive from the state to best support students. And it gives particular emphasis on developing a plan to support targeted student groups, including students from low-income backgrounds, English language learners, and students requiring special education supports. So before I go to the next slide, I want everyone to drop in the chat, what state are you currently in? Where are we? We're just gonna take a second. Where is everyone currently located? I see California, New York, Illinois, Virginia. I see Spain. Oh, someone's not even in the country. Mississippi. Okay, so we have people from all over currently joining us. And just as Texas, just as many people and states as there are, that's how many different funding formulas there are in the country. So every state has its own way of funding school districts and funding education. And on the next slide, I will explain how the state of Illinois determines how we fund school districts. So Illinois, again in 2017, developed the evidence-based funding formula for how districts are funded. And this is particularly interesting in regard to equity because it ensures that no district will lose any state dollars, while it also ensures that districts within the state that have the greatest need receive a higher portion of any new state dollars that are allocated to education. So what this funding formula does is it looks at, or it creates what we call a percent of adequacy. And you can see this here in this image. And this district has a percent of adequacy of 72%. So the way that's determined is the state looks at evidence of how much funding certain student groups need or how much funding is required based on a series of cost factors. And then based on those cost factors and how much funding a district is determined to need to be fully funded to support its students, the state says this district requires X amount of dollars to fully support it, but it's currently only receiving Y amount of dollars, which is the percentage of X, and this is the percent of adequacy. So basically, I'm going to give you an example because that was a lot of letters and a lot of factors, and it's easier if you have real numbers. So for example, if a district needed 10 million to be fully funded, but it only was receiving $8 million, that's in state, local, and federal funding, then the district would be said to be at 80% of adequacy, meaning they only have 80% of what evidence shows they need to be able to fully support their students. And so within Illinois, the lower the percent of adequacy a district has, the more of any new state dollars that district will receive. So again, districts that currently are less close to being fully funded will receive more new state dollars. And so this is how we make sure we maintain equity in our funding. On the next slide, you will see what my work has been with this EBF funding formula. And it's been working with looking at, as districts are planning how they will spend their dollars, how can we as a district take those plans to better understand what districts need for our support? And so as a state agency, this data allows us or directs us and allows us to tailor our work to make sure we are supporting districts as they facilitate equity for students. So I'm now going to pass it to Sarah, who is placed at LA Unified, Los Angeles Unified School District, which is the second largest district in the nation. And she's going to share a little bit about her work in supporting the development and implementation of LAUSD's version of the EBF spending plan. And again, the EBF spending plan is what we require of districts within the state of Illinois. And so now we're going to take a step down from the state perspective into looking at how does this play out on the ground level for districts.
Thanks, Natasha. Yeah, it's been really interesting in kind of developing this presentation together to hear about, like Natasha mentioned, every single state funds schools and school districts differently. And I've had the opportunity this year to learn from my team quite a bit about the way that California funds schools through our local control funding formula, and then be a part of the local control and accountability plan team, which is the strategic plan that the state of California has districts write in order to kind of explain how they're spending these state dollars. So my work on this team, and I'm happy to see here today my LCAP team, Dr. Derek Chow and Sarah Chevalier, who will be a panelist, as well as Karen Long, who have been really great mentors and colleagues for me this year. So the work that I've been doing has been a combination of communication strategy, some policy research and writing, as well as different kinds of stakeholder engagement around our district. So when it comes to communications, we've launched a new LCAP website, and in an effort to really make this more accessible to our community. As you can see, there's a lot of acronyms involved in just this slide alone. I think there's 4 or 5. So in an effort to make the LCAP a little bit more accessible to the community, which is really what it's all about, we launched a new website, and I've been able to interview different folks around the district whose work or roles are supported by our LCAP funding. And I'm currently putting together a district lookbook, which will be able to highlight different programs and initiatives from around the district. I am also grateful that Dr. Zhao had me do research on the Student Equity Needs Index, which I'll explain a little bit more in a bit, and as well as site-based management of school budgets, both important and very timely aspects of our work in the district. And then with stakeholder engagement, this is a big part of the work of the LCAP team, given that it is a document that is put together with the input of a lot of community stakeholders. So we engage with district-wide parent committees, as well as different student groups and external stakeholders or community organizations. So to explain a little bit about what the LCAP is, Like I mentioned, it's a plan, but it's a 3-year plan that is developed each year. And it's meant to be developed through consultation and engagement with stakeholders. Its purpose is to describe the goals, actions, services, and expenditures of the way that our district is spending the funds that we receive from the state, which is called the local control funding formula. And the idea is to support positive student outcomes that address state and local priorities. So the LCFF funds are broken down into 3 categories, which are base funds, supplemental funds, and then concentration funds. I just wanted to quickly highlight what supplemental and concentration funds are, which is that they are required to be primarily spent to increase or improve services and programs to close equity gaps for students who are English learners, low income, and or in foster care. These are the targeted student populations that supplemental and concentration dollars are meant to be primarily spent on. I think it's also important to notice when we're talking about education funding, there are many different ways that districts get funded. And so we talk a lot about our state funding, and this local control and accountability plan does specifically speak to our state funds, but they are not, they don't comprise the whole district budget. So our LCFF funds make up about 76% of what the district receives, but we do receive some other state funds as well as some local funds, and about 10% of the district's funds are federal as well. So because I've learned so much this year about funding, wanted to just make sure that I share that with you when we're thinking about where does the whole pie come from. The state funds are a big chunk, but not the entire pie. Just wanted to share a little bit of the communications work that we've been doing this year. So these are a few of the people that I've been able to profile. We have people around the district who work in roles like pupil services and attendance counselor, specialized student services counselors, parent center directors, and it's been really very gratifying and interesting for me to be able to speak with them and interview them and hear their kind of their idea of what it is that their role is in student equity and in building accessibility for all students. So I will definitely put the link in the chat to the folder where I have all of these profiles that I've created so that you can take a look at them and read about some of these great educators. So part of, as I mentioned, part of my time this year has been spent doing some research and policy writing and white paper writing. So the first project that I worked on was related to the Student Equity Needs Index, which is LA Unified's basically system of allocating approximately 4% of our total budget, which equates to about $280 million right now, directly to schools. And this is through a set of academic and community indicators by which schools are given a ranking and then assigned dollar amounts that go directly to the schools, given that they can give their, that they can use at their discretion. And so this is really the district's attempt to increase equity and to find a formula that allows for increasing equity and also increasing autonomy for school sites. All right, so we are going to now move on to Christina's overview of her work in student health and human services. And I have been able to interact with her department a bit because some of the positions and some of the members of her team are actually involved in our LCAP process. So I'm excited to hear more about her work in the district's nursing services.
Great, thank you, Sarah. So I'm going to start by just giving you a little bit of an overview of the role of student health and human services, and specifically district nursing services. District nursing services supervises student health programming and outcomes on school sites. So they're really the first line of defense and the first healthcare providers that students see on campus. In addition, the department develops and implements district-wide policies regarding maintaining student health in the school setting. District nursing services nurses train, assign, and supervise unlicensed personnel to provide specialized healthcare services. And ultimately, our goal is working to eliminate health-related barriers to learning. Our mission statement is the mission of the Los Angeles Unified School District Nursing Services is to strengthen and facilitate the educational process by improving and protecting the health status of children and by identifying and assisting in the elimination or modification of health-related barriers to learning. So just to kind of give you a sense of how some of that funding is dispersed within district nursing services, we're involved in a number of different programs, from the adolescent health program, the audiometric testing program. We have an oral health program, special education health support services. So if you look through this list, we really are involved in a number of different aspects of district student health and human services programming. School nurses wear a lot of different hats and really are critical to ensuring that students are achieving positive health outcomes on campuses. I'm going to go over some of the work that I've done for district nursing services. So as I'm sure all of you can imagine, it's been a little bit of a crazy year working for a health department in the middle of COVID. And most of my role has been working on projects that the department was not able to work on because attention was drawn towards COVID, and people were not able to take on these projects. So I've been working on a number of large projects, including updating district policies through these documents that we call bulletins. So bulletins are distributed among the over 1,000 schools within LAUSD to illustrate what a district policy is around health. Some of the bulletins that I've worked on include our medication bulletin. So this outlines the rules and requirements for administering medication at school. Food allergy bulletins. This goes over all of the guidelines for assisting a student who has food allergies and how to manage those allergies at school. We have created a new bulletin around administration of epinephrine at school sites. And also I worked on the condom availability program bulletin. So the process for creating these bulletins is pretty extensive. We go through research at the state level. We coordinate with other large districts in the region. We establish committees with representatives from student health and human services and different academic departments to go over that bulletin and make sure that all of the guidelines are really meeting the needs of the students. And then ultimately, these bulletins become district policy. So that's been the bulk of my work over this fellowship. In addition to that, I've been involved in a few different initiatives to increase access to healthcare. Los Angeles Unified is a huge district, and access to healthcare is not necessarily equitable across that district, just due to the difference in neighborhoods, the difference in resources in those neighborhoods. So one thing that I've been involved in is bringing more AEDs to district schools and making sure that every school that has an athletic program has an AED, regardless of where in the district that may be. And also engaging in strategic partnerships with healthcare leaders in LA County, such as LA Care and Children's Hospital Los Angeles. I've been working on a partnership with Children's Hospital Los Angeles to bring telehealth to school campuses to make sure that students are able to get assistance right there on that campus if an emergency occurs. And, it can be really difficult for parents to pick their kid up and take them to a healthcare facility. If we can eliminate that barrier for parents, that is a great way to work towards increasing equity. So that is another thing that I have been working on. And my final large project has been the standardization of professional development. Within LAUSD, we have 6 local districts, and within each of those local districts, the home office did their own professional development programming. So that meant that not every local district was getting the same information. And we really wanted to make sure this year that all nurses were getting equitable information. They were getting the same information. And we wanted to be really strategic and thoughtful about the information we were dispersing to nurses. So part of my work this year has been standardizing that professional development to make sure that all 500 plus nurses within LAUSD are receiving the same information, and that information is being dispersed equitably. And now I'm going to turn it back over to Natasha, who's going to speak a little bit about why we think it's important to have this conversation now.
Thanks, Christina. So why are we talking about this intersection between education finance, strategic planning, and student health? Why talk about this at this point in time? One reason why we feel it's important to bring people together to begin discussing this now is that federal funding from the COVID relief bills for schools is at unprecedented levels. And again, these unprecedented levels of funding mean there is unprecedented opportunity to create greater equity for students in K through 12 education. Right now, districts, if they plan strategically, they have an opportunity to create unprecedented support. Again, it seems like the word of the last year and a half is unprecedented if you turn on the television. But again, it is unprecedented, the levels of support that students can receive with strong strategic planning. And as districts plan, the holistic needs of students should be considered. So that includes looking at the fiscal piece as well as the student health, mental, emotional, and physical health. And so we want to create a space where we can have this conversation to say, what should districts be thinking about right now? How can the state support districts in making sure that all students receive what they need in order to succeed?
Great. And now I have the pleasure of introducing our panelists. So we're going to start with Andrea. Andrea Coleman is a school nursing coordinator with LAUSD, and she has really been a lifesaver for me throughout this past year. She has worked for Los Angeles Unified School District for over 20 years. She has served on the Emergency Immigrant Education Program team, Special Education Nursing team, Medi-Cal Reimbursement and Compliance team, and she has also helped with crafting district policy bulletins. And recently, she has also staffed the LAUSD COVID vaccination site at SoFi Stadium, which is very important work. So welcome to Andrea. Our next panelist is Sarah Shaw, who is a Teach for America alum and also a former Lee Fellow. She worked for the Illinois Office of the Secretary of Education, where she led policy development and implementation. And currently she serves as the Senior Manager, Fiscal and Academic Solvency at the Illinois State Board of Education, where she ensures fiscal policy and supports are aligned with academic policy and supports and vice versa. Welcome, Sarah. And finally, we have Sarah Chevalier, who is also with LAUSD. She is the LCAP administrator. She prepares and presents proposals of the local control accountability plan for the superintendent, senior staff, stakeholders, and the public. She facilitates student, labor partner, and community engagement for the LCAP. And she supports development of local district, community of schools, and school level plans to support low-income students, foster youth, and English learners. So welcome to all of our panelists. And at this point in time, I'm going to stop sharing screen with all of you and ask that our panelists turn on your cameras if you do not already have them on, so we can see your faces as we engage in this conversation. So I am going to start us off with our first question. Given the recent influx of COVID response federal education funds, what opportunities exist for districts to strategically support students? How are districts thinking about this funding in terms of current and future priorities and planning? I'll read that one more time because I know I stumbled a little bit, my apologies. Given the recent influx of COVID response federal educational funds, what opportunities exist for districts to strategically support students? How are districts thinking about this funding in terms of current and future priorities and planning? Oh, thank you, Sarah, for sharing that in the chat as well. All right, and whoever wants to tackle that question, feel free to go ahead.
I'd be happy to take a first stab at it from a state perspective, and then would really love to hear my LAUSD colleagues speak to it from specifically within the district, what that's been looking like. I think, Christina, in your question, the opportunities here, there are opportunities regarding COVID specifically. What does it take to safely reopen schools in a way that honors students and families? Opportunities related to learning renewal So there's both the learning that's been lost from not being in person in school, and there's a lot of learning that's happened as students navigate, as Natasha pointed out, unprecedented times, and figuring out how to address both of those. I loved the framing in the earlier slide around holistic, like there's so many different facets to be taken into account here. And then finally, opportunities related to rethinking systems. We've had more evidence than ever in the last year of where our systems have failed students in the past, specifically in terms of providing equitable education. And COVID is an opportunity, and these funds are an opportunity to rethink some of that. Let's try something new. Here are these dollars. What can we do with them? How can we make our systems work better for our students? So those are the three big buckets that I think about. And I think one of the major challenges at the state level and at the district level is that how to support students strategically and take advantage of those opportunities, because the amount of funds are, no complaints, enormous, but also brings with it a huge responsibility to program them in very thoughtful ways. And these are one-time use funds that will go away in a number of years. So being able to prioritize what does each individual district need? How does each individual district measure their own needs based on the knowledge of their local priorities and their students? And how to use the funds to build capacity so that when they do eventually disappear, those systems have been rethought and rebuilt, and people have been invested in, and what we're left with actually is better than going back to normal. It's having created something that ultimately serves our kids better.
Just to piggyback on that idea, I think what's really exciting about the level of funding that we're receiving is that it completely shifts the conversation away from just learning recovery, just trying to get back to where we were, into a conversation about learning acceleration. How do we come back stronger than ever before? How do we deliver more than we had ever planned for our students? Not just bringing them back to where they were before, but really taking the steps to go even beyond our wildest hopes for the ways we can close these equity gaps. I think another challenge we're all going to be facing is sort of making sure we're taking the time to also get a sense for what those needs are precisely. We have very broad understanding of where our students' needs are, but this is also an unprecedented time in terms of the lack of data. We have so little of our usual data systems in place, so we're all facing the question of, do we go back to look at older data that may not be representative of our students' needs now? Do we wait to try to find what the new baselines are? How do we make sure that we're being strategic and thoughtful and intentional about the way we invest these funds? But as Sarah Shaw mentioned, these are all good problems to have. I would much rather have a conversation about how we can spend abundant funding rather than have to have a much more difficult conversation about what we're able to do with less. So an exciting time, but definitely a time with its own set of challenges for how we serve our students.
And then from the Student Health and Human Services perspective, for example, Student Health and Human Services is a support branch for education. So what we look at is how we can support our students to eliminate barriers to learning, as was indicated earlier. And when we look at LA County Department of Public Health data on where the greatest need is, that was how we placed our what is called our wellness centers across the districts. It was based upon, at that time, the great number of young ladies that had sexually transmitted diseases because of a lack of access to healthcare. And so when we look at the recent pandemic that we are in, one of the things that has been noticed across the nation is that lower income areas tended to have a higher positivity rate of COVID-19. Now, as we're going back to school and looking at the students that are returning to school, we've seen that it is those same areas that have a lesser return of students to school initially, and we're hoping that more of them will return. But as they return, one of the things that is important is educating our students and families, and then providing them with the services that they need. So for example, we have students with exceptional health needs that are returning to campuses. And one of the challenges that we're having right now is just looking at what supports need to be in place for them and utilizing the available funding to do so. So one of the things that was mentioned is that we attempt to have a school nurse on every campus, and not only is the school nurse the first person as far as health that they see, and for many of our students, it's the only healthcare professional that they see. So it's so important to have nurses there. In recent years, we've expanded from just school nurses to licensed vocational nurses on our campuses. And as many of you probably know, there is a nursing shortage right now. And so we are having to utilize our LVN team to support those campuses where we don't have a school nurse. But one of those, like I said, these funds that are being made available right now will help us with going back to campus and supporting the needs that our students have. And we have things in place as far as county health guidelines and how can we support that. And some of that requires additional personnel. It requires additional personal protective equipment. It requires so that students can be safe at school. It requires the COVID testing and vaccination, and utilizing funding that has been available. We've just from district nursing services, utilizing our staff, we were able to vaccinate nearly 40,000 LAUSD staff. And that is something that's helping us safely return to school. And now we're moving forward. Some of that funding will be utilized to provide staffing for vaccination for our students as these vaccines are now eligible starting at the 16 years old. And we're looking at maybe by August, even younger. And so pretty soon everybody will be vaccinated and safe at school. So, and then as far as looking forward, that's how we're looking at during this pandemic right now, because as health professionals, that is where our target is right now. Keeping students safe and bringing them back to campus so that they can learn. And then moving forward, we look at some of these systems that we're putting in place, and they'll help us moving forward as we look at providing services of support to our students so that they can learn.
It sounds like there's a lot of really exciting opportunities and things that are already being put in place. So Andrea, you shared some of the strategies that LAUSD's nursing services is doing, such as the location of the wellness centers and supporting students taking that opportunity to address equity in that way. And so we also heard both Sarah's discuss the sufficiency or the amount of funding that we currently have. And so we heard that it's shifted the conversation away from the struggles around how can we fund these things to now, in what ways is it most strategic to fund these, the needs of districts. And so the next question is, in what ways should districts be thinking about, or for those who are at LAUSD, what ways is the district thinking about creating strategic supports for students most impacted by COVID?
To continue on with the health needs of our students, I think the evidence clearly shows that there are certain demographics or geographic areas where we need to focus more for student health needs. And so as we're addressing those right now, then we need to keep in mind as we move forward that we need to continue to target those areas, and that it shouldn't be a one-time hit and miss. It should be the realization of a lesson learned, and that we need those continuing supports for students, and so that there is equity across the district for all of our students. So that those who don't have access to some things that are more common to other students can thrive and not just, try and survive every day.
I think kind of building on that, and also thinking back to the slide that I was thinking through, the holistic supports for students. One thing we are realizing is that the barriers that we have typically erected between academic supports and school climate supports and health supports, those are fully manufactured. When we've been doing a lot of stakeholder engagement, of course, towards the LCAP. And one thing that's been really interesting for us to learn is that even when we ask a question about how can we support students academically, our parents, our communities, our students are not bound to just that academic lens. They think through mental health supports, they think through physical health supports, social emotional supports. So it really is about making sure that we're approaching the whole child and making sure that we're not just thinking about a student as a learner on one side, and then someone with a physical body on another side, and then someone with mental health needs on another side. That child exists in all of those spaces, and we need to be able to address those needs in a more coordinated way. So breaking down those silos is going to be incredibly important, particularly as we get a better sense for the enormous emotional impacts of the past year on all of our students. I think that is an area that we are working to prepare for, but it is going to have huge academic impacts as well. So making sure that we think through all of those different areas that students manifest their needs.
I'll point to two specific resources that I think one is state specific to Illinois, and then the other is national, that I think can be helping districts think about these strategic supports for students most impacted by COVID. The first is the state-specific one that was produced by our Illinois P20 Council, which is a government public-private partnership. And they put out a large learning renewal guide that gives a sense of how comprehensively a district might think about this question. It has 12 different priority areas, and they really do run the gamut. And I think, to both my colleagues' points, like that ability to kind of to see the picture holistically and then determine where to focus is a really nice way to start, as opposed to beginning from a place of assuming this is where we need to go. There is this opportunity for a breath, even though it can feel like breathing is hard when everything around you is on fire. So starting with that thought around, beginning comprehensively and asking as a team questions to narrow in on what do our data tell us, what are we hearing from our parents and families, what do we know about our own strategic plan and where we need to go. That's one set of thoughts. The other is work that has come out of the Edunomics Lab at Georgetown University, a group that does just a tremendous amount of work around education finance and the impact for students. And in particular, they've really highlighted being able to bring everything down into per pupil cost. Can you talk about, for any considered intervention, what does that cost per student impacted or affected? And it gives a very different way of looking at the numbers than talking about gross amounts of, we're getting this much in ESSER funds, or we're putting this much towards student health. It makes it a lot more accessible to not only district leaders making decisions, but also to parents and community members as well. People know the difference between a $10 investment in their kid versus a $100 investment in their kid. And being able to look at many different options and kind of consider what's the hopes for impact and how much per pupil are we talking about, allows for, I think, a lot more expanded thinking around the types of supports that a district might consider. So as one example, let's say a district has decided that they want to use the summer to invest in their students. They're going to have to be thinking through, does that mean offering summer school to everyone? Does that mean offering summer school to some students? Does that mean remediation? Does that mean enrichment? Does that mean a welcome and orientation for students who have never attended their school in person before? Does that mean welcome and orientation for students who would have been elementary school now going to middle school, would have been middle school now going to high school? And we know we often lose students in those transitions. There's a whole wealth of ways that a district could consider that question of, great, we want to use the summer to invest in our kids, what should we do? And number one, being willing to think through those multiple possibilities. Number two, grounding oneself in like, what do you know from your qualitative and quantitative data? And number three, what's the cost for these different options? Can make it a much more concrete thought exercise that is shortly not going to be just a thought exercise anymore, and in fact, policy put into action. And I think that has been helpful for me personally, thinking about what the state agency is doing and how can we best support our districts in their own thinking.
Thank you so much for sharing these perspectives, as well as for our comments and questions in the chat, and feel free to continue to contribute whenever you feel like it. We wanted to, given the fact that we have our Illinois folks and our California folks, and both states require strategic plans, and both mention the support of targeted student populations. They both use kind of that language. We wanted to kind of compare or maybe hear about the difference between the two. So first, how does the resource allocation priority area of ISBE's strategic plan drive support of targeted student populations in Illinois? And then how does California's LCAP process kind of differ from the way that maybe other states like Illinois or others require budget accountability from districts? And then how is Student Health and Human Services in LA Unified implementing this plan on the ground with its focus on targeted student populations? So really just thinking through how each of these do ultimately support their targeted student populations.
Yeah. So on the Illinois side, I think one thing we often struggle with, and this might be speaking even more to like a state level perspective rather than state specific Illinois perspective. The state is never going to know what the best allocation of resources is. Period, full stop, which was a thing I had to learn coming to the state. Like, oh, shouldn't we know what the best thing is for kids and then just ask everyone to do that? And it turns out that it varies hugely depending on who your students are, what context they are living and working and breathing in, and that the state's role really should be not to do district's job of knowing their kids and what's best for them, but to set a floor of what's happening in districts so that no one's falling below that floor, and then supporting districts to do better than the floor. So not creating restrictions that prevent a ceiling, but really holding that bar. And I think our strat plan reflects that role, that when it comes to supporting strategic resource allocation, the state's job is to provide data and tools for districts to make informed decisions, to educate districts on the intended use of funds, especially as they regard specific student populations, to ease reporting burdens so that districts can focus on what matters, which I think is of particular interest in this conversation because we're talking about plans that we require of districts. And sometimes those are really effective and sometimes they're more pieces of paper. And being able to be in dialogue with our districts about what is actually making a difference or not, I think it's really critical to building something that works. And then the final point from our strategic plan has been to encourage braiding and blending of different funding streams so that pieces that seem like they're in isolation, you can only use these funds for this, you can only use these funds for that, often lead to isolated efforts within districts. And the more that we can be encouraging the use of these funds together, the more we can promote that kind of integrated action happening within districts themselves. A lot of that education data, those tools are focused on specific student groups, highlighting where the dollars can and should go to best support them. And what we have on the front end in terms of encouragement and support on the back end, we also have in our school by school spending data that every state in the country has now, thanks to ESSA. And in Illinois, we've paired that spending data with student demographic data so that whether it's a district leader, a school leader, a parent or community member, taxpayer, can pull up any school and see relative to who is at the school, how much money is going to that school, and really get some conversations going about equality is not equity when it comes to funding, and we do want more funding going to the places where it can accelerate learning most impactfully. So we've got front-end supports, back-end data, and trying to make that connection happen on a really regular basis between districts and communities and within districts themselves.
So speaking to LAUSD's LCAP process, I think one thing that's really interesting about the LCFF and about the way the LCAP moves through California is that you have to submit and approve your LCAP alongside your budget. If you do not approve your LCAP, you do not approve your budget. So it is not just a nice to have, it is not a separate conversation. It all has to move together. There is no such thing as a budget without an LCAP. So I think that is really important framing in terms of giving stakes to this work. Because otherwise, yes, there is a risk that this turns into just another piece of paper, or in our case, another stack of paper, as our plan does tend to be rather long. But I think with that in the background, it also helps drive the kind of stakeholder engagement we do. So I think one of the big focus areas for us in LAUSD as we work through this LCAP process is how to make this work meaningful all the way across the system. Obviously, LAUSD is enormous. And so how to make sure that we're writing a plan that actually addresses the needs of all of our students and reflects the perspectives of all of our communities is a daunting task. So part of that is around the kind of work we do at the district level for our engagement to really bring our stakeholders into the conversation. But one thing that we've been doing and that Sarah Cohen has been so helpful in has been articulating this work down. So making sure it's tied down to the planning that's happening within our 6 local districts, the planning that's happening in our, I believe we're at 40 some communities of schools. I don't have the number off the top of my head. And then of course, the school level planning that has to happen as well. So this is all work that is not just happening in a kind of one and done enormous district plan, but that it's actually filtering all the way across. And that means as a result that the focus on students and on these LCFF student groups of low-income students, students in foster care, and English learners also articulates all the way across the system. So it's definitely, I think the LCAP and the LCFF is a very specific policy in general, but I think one thing that's been really exciting has been to see the way that we even have to kind of further differentiate how that looks in a district as large as LA Unified, and how do we make sure that this is a meaningful process, even when we're talking about the 2nd largest school district in the country. So how do we make sure that this work really reflects the voices of our stakeholders? Because as Sarah Shaw mentioned, it is not our job to pretend we know better than anybody else. In our LCAP team, our job is to make sure that this is a plan that reflects the needs, priorities, and voices of our students, their families, and our communities. So making sure that that work is clearly implemented all the way down.
And then to address how Student Health and Human Services is implementing this plan and its focus on targeted student populations. I think that one of the things is that Student Health and Human Services composes several different departments, nursing services, medical services, school mental health, and then pupil services and attendance, student support services, I believe it is. I'm trying to get all the acronym, restorative justice. So what we do is in each one of those departments, each department has the responsibility of looking at the students that they serve. And one of the efforts that has been made within student health and human services is, like has been indicated earlier, how do we holistically address the needs of the students? Because there has been a lot of working in silos, and some of that work now has been about, with these targeted student populations, making sure that we're all moving together in the same direction, that we're communicating across departments with each other, and case managing students, so that we make sure that we're not addressing the same thing from each person individually, but together addressing those students' needs, are the needs of the certain populations, whether it's our foster youth, and I'm trying to remember the other target, as our special ed students, whatever population of students it is, we're all there at the table to talk about what these students' needs are. And as we listen to each other from the different departments, it broadens capacity of what we're able to do for our students. And then the local control and accountability plan actually helps us with addressing that, because we have to look at the different areas of this plan and the requirements of how that money is spent, and give written accountability of how we've used those funds to address, and what are the outcomes, and not just say we're going to do, but then be able to communicate what the outcomes were of our intended goals.
Thank you all for sharing your answers to those questions. I have the distinct pleasure of asking you our last question, and it's kind of a fun question. I'm going to ask, because we are running a little bit low on time, that in 1 or 2 sentences, you provide an answer to the following question. The COVID-19 pandemic has highlighted and exacerbated current educational inequities. In your role, or in a perfect world, what structures or systems would you keep or change in order to actualize equity?
I think that one of the things that has happened with the pandemic is we've had to reach outside of the district to address the needs of our students. So even though we've had relationships with different entities, different partners, we've had to expand that. And so with some of these partners that we've been addressing with needs related to the pandemic, and those needs that were being addressed there, whatever it was, whether it was, academic needs, because we went virtual. And I think one of the things in LA Unified was that, sure, we had technology at certain levels in some schools, but we were in a situation where we needed technology across the board for everybody all of a sudden. So, we had to utilize funds for that, and there were partners for that. And then I know I'm not supposed to be long-winded with this one, but with all the partners, whatever they were, and I know with my department, we've always communicated with public health. So we've had to do that even more. And so that lets us know that as we move forward, we want to keep those connections and continue to broaden our reach with partners so that we can address the needs of our students.
I'm going to modify the question a little bit to say, what are the lessons that we've learned from this pandemic? So I think there are 2 for us. I think humility in realizing we don't have all the answers, and therefore we need to partner with our entire community to be able to find those answers. So I think that's been one major lesson learned. And the other one is flexibility. It is remarkable how across the entire country, everyone has been redefining education at the drop of a hat. So if we can do all of that, things that no one ever thought we could do, imagine what else we can do if we're trying to do it on purpose. So yeah, humility and flexibility, I think.
And when I was thinking about this question of structures and systems to keep or change, I think the criteria I'd use is a twofold criteria. First is it a structure or system that upholds progress toward equity and outcomes, that we've achieved a measure of equity if children's life outcomes are no longer predicted by where they're coming from. But then I think a second one that has been echoed many times today, and I'm going to borrow this language from an organization here in Chicago that I think does tremendous work around this, Chicago United for Equity. And one of their statements is, we believe that those who are most impacted by policy decisions should be in the room, at the table, and active participants in determining their future. So any structure or system that isn't aiming to get us to equity and outcomes and isn't doing it in a way that's working directly alongside the people most impacted is a structure that needs to be critically re-examined, adjusted, and if necessary, thrown out.
Thank you all so much for participating and being such great, thoughtful panelists. We're so lucky to have worked with all of you directly this year and to have learned from you today and all year long. We did have a few quick questions in our chat, so I just wanted to see if anyone from the panel wanted to address them. One was about whether low-income districts have a team that's well equipped to create a specific needs assessment that proves that they're entitled to the relief funds. Does anyone want to take that one? Let's see, what else? Do we have another one?
I'll say, Sarah, just I got kicked off the webinar for a brief moment, so I didn't get to see that question come in. But as what I hope is a non-answer that also acts as an answer, there shouldn't be barriers to districts being able to access the federal funds. I can't speak to what's happening in California, but in Illinois, there was a concerted effort to make that application as streamlined as possible to fulfill the federal needs, but just get the money out the door as quickly as possible. There are always the bureaucratic strings that still need to be in place to make sure that there's the paper trail and that districts don't have to worry about the funds coming back to collect the money again. I think the harder part of that question is districts' ability to, and this is true for any district, I think, right now, but particularly in districts that are already grappling with how to support their districts in many manifold ways, getting that time and space to, once we have the dollars, figure out what to do with them, or when we're thinking about how to communicate what to do with them, how that comes across. So it is not an easy question.
Thank you. Are there any other questions that anyone wants to put into the chat? Or obviously you can come on the mic and say and ask anything you'd like at this time. Okay. Well, if you think of anything, you can also reach out to us, of course, individually, or we can, I'm sure, connect you to one of our panelists if you think of any questions after we adjourn. But we just wanted to, again, thank you so much for being here with us and for supporting us in this journey in many, many ways in our journey as policy fellows, and for attending today. So just a big heaps of gratitude to all of you, and to my fellow fellows. Just wanted to say that one more time, Christina and Natasha. Thank you. And to our Lee staff who's been here with us today as well, Tasha and Andrew. Thank you.
And enjoy the rest of your Tuesday, everyone. Thanks so much.
Thank you, you too.